Okay, so James, how has the opioid crisis affected you guys?
Yeah, so with the opioid crisis, it's really opened the conversation for people to look towards a non-pharmacological or non-invasive management for long-standing or complex pain. So we're seeing a lot of people come in who have been on medications for a long period of time and are just looking for more substantial relief outside of those medications.
Right, people just want to be pain-free. Okay, and what are the most common problems you're seeing day to day, Dustin?
So we have a wide spectrum of patients that come into the office. We take everybody from the weekend warrior that just come in with aches and pains, and then we also manage the complex patients. So disc herniations, severe leg pain, shooting pain down the arms, numbness, tingling. So, you know,
Just a wide variety of range.
wide range of patients.
Well, it's so nice to know that you have somewhere to go and you can manage these types of problems. How do you guys do that?
Yeah, so we have quite a few options within our clinic. We like to take a stepped approach to care. So we start with the least invasive means possible. Sometimes that's just movements, some stretching, some exercises, and then we kind of work our way up through interventions. We also have a lot of options outside of standard chiropractic care. We do non-surgical decompression, and we use laser therapy a lot of the time, which is a hands-off approach to really get some people some pain relief.
Laser therapy, is that newer? Is that becoming more popular?
It is newer. The research has just been coming up in the past couple years for it, but it's looking really promising. It's really great at managing inflammation and localized pain.
Oh, so good. Okay, and what sets you guys apart from other chiropractors?
I would have to say,
I know, like Tammy said, it's like everyone feels like they're family there too.
and we try to have a good, a good vibe in our office.
Yeah.
Keep everything positive. But I think what really sets us apart is our approach to the problems.
Yeah.
So we just want to sit down, have a conversation. Our goal is not to, put you on the table and rack you and crack you, so to speak.
Right.
It's really sitting down, figuring out what the best approach is for everyone's problem, because everyone's different.
Everybody's different. Okay, and so do people come in and have a consult if they're nervous right now, if they're sitting at home going, I don't really want to talk about it, but I know I need to. What advice do you have for them, James?
Yeah, absolutely. So with anything spine, the first option is try and move it. If you can get it moving well, typically it'll feel well. But when that doesn't work, or when you've had a lot of other interventions, say injections, maybe even a failed surgical procedure, we would love to have you come into the office, bring any images that you've had through time, and just give us a little bit of your history. We'd love to sit down with you and just be able to have a conversation and help you navigate what other options may be available and see if you'd be a good fit for care in our office.
Because like you said, everybody is different. Don't you think it affects the whole family too? It's not just the person in pain?
It absolutely does.
Yeah.
As people are going through this process, and when they start from ground zero and get better, you just see you see more smiles in the office, and it's just a really good feeling.
And that's what you want to see.
And pain is a really important thing that we look at as we go through, but when it affects the family, a lot of the times it's because the pain is keeping you from doing something that you love.
Sure.
And our goal is to help you be able to return back to full function.
And being happy.
Absolutely.
I love it. Okay, James, where can we find more information?
You can look us up online. Our website's aspenfallsslc.com, or you can just type Aspen Falls into Google and find us there.
Perfect. Gentlemen, thanks so much.
Thanks for having us.